Mrs. Ann McCarthy, 32 years old, arrives with her partner at a family practice unit for her first prenatal visit. She is 8 weeks into her first pregnancy. The scene takes place in the consulting room, where the doctor has just finished examining her. The doctor takes notes in the patient's medical file and asks the patient and her partner to come and sit down facing her.
Now that you've had your first examination, which is to get a sense of your general state of health, I'd like to give you some information on pregnancy and, of course, answer any questions you might have.
Okay.
In the first weeks of pregnancy, there's a decision you'll have to make. It's about whether to take some tests that tell us about the baby's risk of having genetic problems, such as Down syndrome or trisomy 21. Do you know what Down syndrome is? So you need to decide whether to take a test or not. And if so, which one? Some women of your age, in their early 30s, choose to do the test and others choose not to. It depends on what's most important to you. My job is to present the options, and then you can make the decision you're most comfortable with.
Do we have to make a decision right now?
No, don't worry. Here's a decision aid which tells you what the options are, what can happen after the prenatal screening test, and what are the benefits and harms of doing and not doing the test. So you can decide whether to do the test or not. And if you decide to do it, which one to do? I'll explain what's in the decision aid, and if you have questions, just stop me.
Sure, thanks.
First of all, this prenatal screening test is so that we can see the risk of the fetus having Down syndrome. It's just a screening test. So it only detects the probability. It's not a diagnosis. If the test says the risk is high, we might suggest you have an amniocentesis. That's to see if the fetus does in fact have Down syndrome. Amniocentesis is a diagnostic test. A small sample of liquid surrounding the fetus is taken using a needle inserted through the mother's abdomen into her uterus. This process is guided by continuous ultrasound. Listen, there's a risk in doing an amniocentesis. About 1 in 900 pregnant women who do have an amniocentesis have a miscarriage. Okay so far?
Yes, okay.
So if you decide to do the screening test, depending on which test you choose, it'll consist of taking 1 or 2 blood samples and maybe an ultrasound. The first option is Serum Integrated Prenatal Screening, or SIPS, SIPS. You'll have 2 blood tests, the first between the 10th and the 13th week, and the second between the 14th and 16th week of pregnancy. The second option is Integrated Prenatal Screening, or IPS. You do the same 2 blood tests plus an ultrasound of the back of the fetus's neck between the 11th and 14th week of pregnancy. The third option is non-invasive prenatal testing, or NIPT, NIPT. You'll have 1 blood test after the 9th week of pregnancy. But you also have the option of not doing any test.
Okay.
All pregnant women can take these tests, but some women are at higher risk. For example, the risk of trisomy 21, trisomy 18, and trisomy 13 increases with the mother's age. Out of 10,000 pregnant women aged 25, 9 are carrying a fetus with trisomy 21, these blue ones. 2 are carrying a fetus with trisomy 18, these orange ones. And 1 is carrying a fetus with trisomy 13, the gray one. But for women aged 45, out of 10,000, 320 are carrying a fetus with trisomy 21, 133 are carrying a fetus with trisomy 18, and 27 are carrying a fetus with trisomy 13. There are other risk factors too. Women who've had an abnormal ultrasound, women who've already had a Down syndrome pregnancy, and women with a family or personal history of chromosome abnormalities are at higher risk. Do you think you have any of these risk factors?
Not that I know of, but I could check.
You can look at the decision aid to help you think about it. It'll help you see the benefits and risks of doing the test or not doing it, and to decide based on what's important to you. If you decide to go ahead with the test, the decision aid will help you compare the different tests available. Do you see how it works?
Okay, so here are the concerns I might have about each test and their importance to us. So I circle its importance based on my preferences and feelings about it. Is that right? And add my own concerns. And then here I choose the best test for me considering each concern. I guess this could help us discuss the decision with friends and family too.
Yes, you're absolutely right. Now let's talk about the benefits and risks of doing the test and also of not doing the test. One benefit of the test is that you'll know what your risks are of carrying a fetus with Down syndrome. For example, out of 10,000 women of all ages who did the SIPS test, 9,479 women, these green ones, showed low risk of having a fetus with Down syndrome. However, 4 of the women the test showed as low risk were in fact carrying a fetus with Down syndrome.
So the tests can be wrong.
Sometimes it can be. And so those 4 women were wrongly reassured. Also, you should also know that some tests like NIPT may not give results the first time. Out of 10,000 women who do the NIPT test, 500 women will have to redo the test. In that case, they can redo the NIPT or else do one of the other tests.
So what if the test says you're at high risk?
Good question. These women will be invited to go back for an amniocentesis to check further. For example, out of the 10,000 women who did the SIPS test, 521 women were shown to be at higher risk of carrying a Down syndrome baby. And then, of these 521 women who had the amniocentesis, 499 were not actually carrying a fetus with Down syndrome, and 22 were. These red ones at the bottom.
So let me get this straight. For the ones who screened high risk and then did an amnio, but who weren't in fact going to have a baby with Down syndrome, the screening test was kind of a false alarm for them.
Exactly. They were worried for nothing. But the 22 women who did have a fetus with Down syndrome were better able to prepare for the arrival of a child with special needs. Or else, they could consider the possibility of an abortion. But you also need to remember that about 1 of 900 women will have a miscarriage caused by the amniocentesis. And it's likely to be a fetus that does not have Down syndrome.
So if I decide not to do the screening test, I'll avoid the risk of going through an amniocentesis for nothing. And I'll also avoid the risk of a miscarriage caused by the amniocentesis. And I won't be worrying about test results.
That's right. But you won't know your risk of carrying a fetus with Down syndrome. For example, out of 10,000 pregnant women who decide not to do the SIPS test, 22 are carrying a fetus with Down syndrome. The red ones here.
I see. So those 22 women are going to have a child with Down syndrome, but they won't know it in advance if they choose not to do the test.
That's right. Do you have any questions? Is everything clear so far?
How long does it take to get the test results?
Different tests have different wait times. For example, for the NIPT test, you'll wait a maximum of 7 to 10 days. Waiting for test results makes some people anxious. Do you have any other questions?
No, I don't have any. Do you have any questions?
No, so far everything seems clear to me.
What you should remember is that you must make your decision based on what is most important to you. What is most important to you? What are your thoughts?
It makes me think. I'm pretty sure I could live without knowing all that about the baby, but I think my partner would be reassured if we had a blood test that showed us our baby was not likely to have Down syndrome.
Right. And how do you feel about it?
Well, the idea of having a Down syndrome child kind of worries me.
But I have trouble with the idea of an abortion, and I don't like the idea of losing the baby because of an amniocentesis. But we're both involved in this.
If it's reassuring, I think it's worth it.
I'd feel better if we had more time to think about it.
Okay, so between now and your next appointment in 4 weeks, talk about it some more together. You can also talk to your friends and relatives. Think about the options and which one best matches what's important to you.
Okay. It's a lot of information to remember. Can we keep the booklet?
Yes, it's for you. Think about the information on the first 3 pages and then fill out the other pages. Bring it with you when you come back here in 4 weeks.
Great. Thank you very much.
Have a great day. Bye. Today's the day you make a decision about the prenatal screening test.
Right.
Have you had time to look at the decision aid I gave you?
Yes. And we talked about it.
Have you had a chance to find out more from other sources or to discuss it with your friends and relatives?
Yes, we talked to our friends about what they did.
Perfect. Let's go over the options and go over what's most important to you so that you can make a decision you're comfortable with.
We circled the importance level of each benefit and harm of doing and not doing the test, and made some notes.
Great. I see that knowing your chances of carrying a fetus with T21 and being reassured are very important to you.
The main benefit of the test that I see is knowing the risk of having a child with Down syndrome. And that means I'll be less worried about it because I'll know what the risk is.
Right. I also saw that the anxiety about waiting for results is also a concern for you.
There's a long wait to get the results. I know I'll get stressed waiting.
Also, the results could be false. They might tell us we have a high risk of having a Down syndrome child, whereas in fact we don't.
Is there anything else that concerns you?
There's also the risk with amniocentesis. Some women who've had it done have lost the baby.
Yes, although it's a small risk.
You can choose not to do the test. That's also an option.
Yes, and the benefit I see of that is that we won't have the worry of waiting for the results, especially if I'm not considered at risk of having a baby with Down syndrome. On the other hand, not knowing can be hard for people who don't like the uncertainty of perhaps having a child with special needs.
Some people are ready to live with that, and some are not.
Yeah, we thought about that.
At this stage, I'm pretty sure you understand that you have the option to either do the screening test or not do the screening test. Do you have any questions?
No, that's okay, thanks. The information you gave us and our discussion helped us sort out our thoughts. I think we agree.